Your baby is arching their back and your first thought is reflux. Most of the time, it isn't. Back arching has at least 5 different causes, and 4 of them have nothing to do with pain. Your baby isn't malfunctioning. They're telling you something in the only language they have. It looks alarming, it feels urgent, and it sends most parents straight to Google, straight to the pediatrician, straight to reflux forums at midnight. Sometimes that's the right call, but most of the time, what you're watching is not a medical event, it's a behavioral one. Let's go through what's actually happening in each context. The first and most common cause is protest. Your baby doesn't want what's happening right now. Being put down when they want to be held, a feed ending before they feel ready, being placed in a position they find uncomfortable, a transition they didn't consent to. Back arching during these moments is not pain, it's the most dramatic no, available to a being who doesn't have words yet. It's refusal made physical, and it's completely normal. The second cause is overstimulation. When a baby's sensory system has had enough, the body communicates that overload through movement. Back arching is one way the nervous system says, too much, too loud, too bright, too much input, too long awake. If you're in the middle of play or interaction and your baby suddenly arches away from you, they're not rejecting you. They're self-regulating, asking for a reset. And there's a 2-second habit that tells you which, because you're looking at almost every time. I'll get to that shortly. The third cause is excitement, and this one catches parents off guard. Some babies arch backward during moments of high positive arousal. Seeing a face they love, anticipating a feed, a moment of pure physical excitement that the body can't contain. The same movement that looks like distress in one context is pure joy in another. Context is everything. The fourth cause is digestive discomfort, and this is the one parents usually jump to first. And yes, reflux, gas, and constipation can all produce back arching because the movement instinctively shifts pressure in the abdomen. But here's the thing, digestive discomfort, arching almost always comes with other signals. Crying that doesn't stop, feeding refusal across multiple sessions, visible distress before, during, and after feeds, not just the arch. The arch alone, in an otherwise content baby, is almost never the full picture. The fifth cause is neurological development. In the first few months, babies have a reflex called the Moro reflex. A sudden stimulus, a loud noise, a sensation of falling, triggers a whole body startle. Arms out, back arches, then pulls back in. This is built-in, automatic, not distress in any meaningful sense. The brainstem doing exactly what it was designed to do. It fades over the first 3 to 4 months as higher brain centers come online. So how do you actually tell the difference? Read what came before. Was your baby in the middle of play and you moved them suddenly? Protest. Were they being held by someone unfamiliar and you noticed them starting to look away? Overstimulation. Was something exciting just about to happen? Possibly joy. Have the feeds been difficult, with consistent crying and refusal? Not just occasional fussiness. Worth mentioning to your pediatrician. The body is always communicating. Back arching is not random. It is a signal with a sender and a message. And when you start reading it as communication rather than malfunction, everything shifts. You stop panicking, you start decoding. So the next time your baby's whole body curves backward, don't go straight to what's wrong. Go first to what they're trying to say. Most of the time, you already know enough to figure it out. You've been learning their language since the day they arrived. This is just one more vocabulary word. There's something worth saying about how to observe this behavior rather than just react to it. Most parenting instincts move toward action. Baby arches back. Do something, but with back arching specifically, the most useful first response is actually stillness. Watch for a few seconds before intervening. What was happening right before? What did the face do? Did the body relax after a moment? Or did it escalate? That window of observation, 2 to 5 seconds, often gives you more information than anything you could do. It's also worth knowing that back arching sometimes signals the tail end of an interaction rather than the beginning of distress. Babies have what researchers call a regulatory window, a period of engagement they can sustain before the nervous system needs a break. When that window closes, the body communicates it. Back arching, gaze aversion, yawning, these can all be signals that the window is closing. Not that you did something wrong, that the interaction ran its natural course. Recognizing this changes the response. Instead of trying harder to engage, you offer a transition, a change of position, a quieter environment, a moment of simply being held rather than stimulated. When should you take back arching to a pediatrician? There are specific patterns worth flagging. Back arching that occurs consistently during and after every feed, combined with visible discomfort and poor weight gain, that's a reflux picture worth assessing. Back arching combined with neurological signs like asymmetry in movement, extreme stiffness, or unusual eye movement is also worth discussing. And any back arching that you can't contextualize, that seems to come from nowhere, repeatedly, in a baby who otherwise seems unwell, deserves a professional eye. Your instinct matters here. If something feels different from what's described in this video, trust that feeling. The pediatrician is your partner in this, not a last resort. Next week, the 3 a.m. grunting and straining that makes every parent think something is wrong, and the reason it's actually a sign of something going right. Follow so you catch it. We'll see you in the next one.